Thank you to all of our panelists. Do we have any questions or comments from committee members at this time? Dr. Wood, then Mr. Thurman. Mr. Thurman.
Thank you, Mr. Chair, and thank you to all the panelists. And thank you, Ms. McCoy, for your work. Having served at 2 regional centers, I have an appreciation for what your caseload size must be like. What is the caseload number that you currently are seeing?
I have 100 on my caseload.
Did you say 100 families that
100 families and
that you're responsible for serving? And so, I think that paints the picture and complements everything you said about the details. That's difficult for one person to serve 100 people. Thank you. Mr. Rogers, I want to ask you if you could just set the stage for us about urgency and timing, because, I've heard some people say that, yes, we should serve and increase the revenue, but we can wait, a year or 2 years or until the budget's this or that. And from my perspective, we need to make a decision before September. And if you could just comment on some of the consequences that we would experience if we were to be sanctioned again for not meeting the caseload requirements. What could the financial consequences be to our state, since this is an entitlement? And then what are the real consequences for the people served if any more of these vendor agencies should close because the rates have been so low? Just to put it in terms of human conditions, the cost to a human person, and then the cost to the state in terms of possible sanctions.
Thank you very much, Mr. Thurman. We actually talked about this eventuality as possible questions. Let me just start from on the impact, the most important part, the impact of the individuals who are being served. The ability to deliver effective case management. 16 months ago, I was a director of a regional center. I can't come to tell you that this hasn't had an enormous impact on a regional center and all the other 20 regional centers. Relative to ratios, significantly is where you live and the impact, because we've already very accurately stated to you, and we've given you additional information. You can have very specific information relative to what the funding for all of our programs have been. It was accurately described here. These circumstances that has had a horrific impact on the ability to deliver services to individuals under the Lanham and Developmental Disability Services Act. We've been very forthright about explaining that from the regional centers, and I now, as a director of the Department of Developmental Services, responding to one of your questions. The future aspects of it is that this builds on a continuity that you do not want to have. The inability to grow your programs, to deal with the emerging needs that we already have explained to you, as I've already shared with you privately and to this whole audience today. It's a growing population. Individuals on the autism spectrum that are eligible under this progressive law are growing, and growing. Right along with that, as I mentioned before, they are also moving out of special education into the next aspect of their life, and those needs they have will cost resources to fund and support them. So we have a growing population. Those are converged at a critical point. In the budget process of this year, and now move to a special session, that becomes the number one key issue of how we go forward. How we'll present with you. We have presented through our providers, and you're going to hear more of that testimony, the specific needs, systemic needs relative to maintaining the service system. That's my candid response.
Mr. Mace.
I struggle a little bit with this because I've been in this office for a little over 6 months, I guess 7 months now, and right away when I took over, and when we started this session, all my locals came to me and said, "This is a problem. This is a problem." And it wasn't a problem just this year; it's been a problem for many years. Why wasn't this addressed in the normal budgetary process? And if a couple of different comments would be fantastic.
Oh, okay. Proposals were made during the normal course of the budget process. And those proposals have matured, and we're sitting here. That was what I just responded to, relative to what the proposals were. The proposals from other entities and other people are in the room. I defer to them.
That's above my pay grade, so I can't answer the question directly.
Your opinion would be fine. Your opinion would be fine.
Maybe not my opinion, but we came together like never before as a community across California of service providers and regional centers and advocates, and that's why you were hopefully inundated with meetings as many members were across the state. We were hopeful. And we were extremely hopeful that you all had heard us, and during the budget sessions, we felt that you had. And why we're here today is beyond my labor grade, but as a community, we've never done this before. To this degree, that is.
Other members with any questions or comments? Mr. Thurman.
It's a broad question. I appreciate my colleague's question. I think it's a great point about why we're here and why this has not happened. I can say, having worked for 2 regional centers, what I've seen in my own experience is that over the course of the last 10 years, every single service that goes directly to the families has been cut and chipped away because of the really bad state budgets. I can tell you, having chaired the Health and Human Services Subcommittee, we discussed this at great length. And that subcommittee did make a recommendation to move to a 10% increase over a phased period of time. But one thing that we did experience is while there was wide support for that, at the same time, because everything has been cut over the last 10 years, there were so many proposals for increasing that no one area could see this type of increase in one budget year. For example, a 10% increase here, a 10% increase in Medi-Cal, which we'll also be talking about. Both those things were proposed but could not be sustained because of the number of cuts that have been made over the last 10 years. I think your question is a great one. I guess the other question I would ask all of us is, we are where we are now, what are we going to do about it? So we have 2 choices. It was framed for us today. If we don't act now, there will be financial consequences to the state that are upwards of $100 million, I think, from the previous sanctions some years ago. But even greater than that, there will be the consequences to the individuals served who cannot get a place to live, who cannot get a training program or a job, and who cannot live with dignity. The bigger question for us to answer is, what are we going to do about it? We are where we are now, and we need the money now.
Thank you, Mr. Thurman. Ms. Campos.
First of all, thank you, Mr. Thurman, for your comments on what are we going to do now. And let me just kind of recap some of the things that you brought up when you talked about numbers. You talked about, in order for us even to be able to serve, what was the number again of service providers that we would need, or service coordinators, I think you called them. What was that number again? Was
that was 663.
663. So we would need that number to be able to serve the clients. Is that correct?
We would need that number in order to come in compliance.
To come in compliance
with the Lanterman Act.
And what would we need? What number do we really need then? If it's not, so that's just to be compliance. So is that the same as what we would need?
No, because understand that, at least at my regional center, we're experiencing growth like we never have before. Last year, we grew by a net of 1,400 clients. We went from up to 24,000 clients just at my regional center.
So that's just compliance. Do we even know what we would need to be able to serve at the capacity so that people are being able to receive the quality of service they need? Well, first of all, we have to figure out how we get that number, right?
That's correct. And what I would add, Assembly Member, is that calculation, we could give it to you. I would rather not estimate it, but it's a significantly higher number.
But this is what we need to focus on now.
I don't dispute what was just shared. Each of the 21 regional centers are growing differently in their geographic area, as you already understand as Californians, relative to growth in the urban areas as well as the rural areas, interesting enough. But that number we could give you an estimate on. we're talking about the ratio, the statutory ratio or contract ratio we expect for the regional centers to deliver through their case managers. And that was the estimate that we're not disagreeing with. You asked the question of how much more do you need, and that we would have to provide for you.
Yeah, that's fine. I think if we can't even come into compliance, we have a bigger issue on addressing this, and then what do we need to be able to service?
We have a super challenging situation.
Thank you.
Thank you, Ms. Campos. Ms. Bonilla.
Thank you for that question, Assemblymember Campos. I think that was really excellent to put a spotlight on it. And I guess one of the things I've been thinking of is, is there a mechanism, and when do we reach, and I believe we're here, a crisis point? When do we declare an emergency? We deal with that in so many areas in the state, whether it's drought or a fire, and we know that our public schools, for instance, were in a state of crisis and emergency and addressed it. And I guess I'm just wondering if you have any suggestions in terms of how we can frame this in a way to make sure that we have all the tools we need to actually address this. Is there because I just continue, and I've met with many advocates, and there's a real sense of frustration that we're not getting the message out, that we're not adequately communicating the scope of the crisis that we're in, and what the outcomes will be if we don't achieve restoration and then a long-range plan. And do you have any suggestions? What are you thinking, and how can we as legislators help communicate beyond a sense of urgency? I think a sense of urgency we passed a few years ago. So how do we adequately explain to our colleagues and to our constituency what we're really facing here, and to the administration as well?
I think I'm going to speak from it as a longtime professional, 47 years, and to answer a very what appears to be a simple, very important question. I don't disagree with the question, and not be short on my explanation. I think we have the capability of identifying the challenges that we've already been talking about. And we've talked before this committee and other committees, rather outside of this special session, on exactly the question you just asked, outlining the higher priorities of issues and what caseload ratios should be and how we would achieve it, and then the actual cost to do that, and then do it incrementally through the regular budget process, as I alluded to before. I think we have a plan. The plan to achieve it is a funding issue relative to funding priorities. It's really just that clear. It's funding priorities of how we move forward. We have competing issues, as we've already mentioned to you, that we've been very forthright about relative to our compliance and our partnership for the Centers of Medicare Services, who are funders for some of our programs. And as a result of that, there are compliance issues built right into that as we are closing developmental centers, and to be certified and be recertified for a time period. Those formulas and our ability to come up with that that capability is available to us. And I think I'm trying to combine a very complicated issue in a relatively simple way. I think we have that information available to us, and can present it as a result of how much this would cost and over what time period in the prior proposals before the legislature.
Just to maybe, as we're considering a pathway to solutions, in our hearings, one of the things we need to look at is some mechanism where we don't end up here again. If we're able to solve this, where something is triggered and we say, this is now an emergency, this is now a priority. I would love to see that built in, to say, yes, we have reserves, a rainy day. Well, if it's pouring, how do we put something in whatever we do now to say this is a trigger, this is something that has to be spent? I think that's important. Otherwise, we're just going to, go through the cycle again, and we're going to gut the system again, and have such a fragile care and no long-term, security of this being a priority. So that's just something I wanted to put out there, that I would love to see in the language something added that says, when we reach a certain non-compliance point, then you know what? We got to do something about it, and that it may not be all of us, but that this is a state priority. So I just would throw that out there, that just like we trigger a state of emergency and other issues, I would love to see something built into whatever solution we are trying to come up with.
Okay.
Mr. Mace.
Just to clarify, because I'm not sure I heard the answer, are we currently in a crisis state?
Yeah.
And if we are currently in a crisis state, when did that crisis state begin?
If I may,
Yeah,
daily at regional centers we deal with crisis. So when we have a person who is in county jail for a year and we can't find anything for him, and a judge calls him, he says, "Get your person out of my jail, I got a crisis." Right now, for the first time ever, we cannot find enough providers to serve children with autism. They're going without their ABA services because we're losing them all to the commercial insurance plans, and they pay a lot more than we're able to pay. So to me, if a child is going without ABA services with autism, that's a crisis. And we're experiencing those every day. And when we get to that statewide crisis, I can't answer, but at my regional center, we deal with them daily.
When did that start? How long ago?
Since before the recession, since maybe the early 2000s, with the intensity that we've been experiencing.
Okay, thank you.
Thank you. Just had a quick clarifying question. We've heard some testimony already about how high the current caseload ratios are. We heard the figure from Ms. McCoy about 100 families, and we also heard the figure of 663 more service coordinators statewide needed just for compliance. Can you please remind the members of the committee what the average caseload ratio should be?
Yes, I can speak to that. In statute, there are 5 different caseload ratios depending on the individuals being served. So an individual who is in early start, meaning they're 0 to 2 years of age, the caseload ratio is 1 to 45. For an individual who is on the home and community-based services waiver, the caseload ratio is 1 to 62. And so there's 5 different categories, and individuals who don't fit into the early start or waiver, or who have not recently moved from a developmental center, then for those individuals, the caseload ratio is 1 to 66. Our department surveys regional centers annually for their caseload ratios, and we keep that information historically. And in the past 2 years, it's the first time that all 21 regional centers have been out of compliance with at least one, if not more than one, area of the statute.
Thank you, Mr. Winfield, for that very detailed and precise response.
And I'll just add to it, Mr. Bonta, that we will send you those data so you don't have to write it down. And the second most important part is that we've reported on that as updating in these chambers, both sets of chambers, relative to the last 36 months.